The Canadian province of Ontario has a population of more than 12.5 million. People there can spend their money on all the best things in life: food, wine, cars, homes, everything, except their own bodies. That's because private health care is outlawed in Ontario. Under their single-payer system, only the government can pay for medically necessary care. But that's okay, say some, because you shouldn't have to worry about money when you need health care. And that makes single-payer systems more compassionate and caring than the partial free market system in the United States. So how compassionate and caring are single-payer healthcare systems?
They don't care how long you wait, you'll get to you sooner or later. But it's free. It's free.
Lindsay McCreath, a retired body shop owner from Newmarket, Ontario, began having headaches and had a seizure in January of 2006. Both he and his doctor suspected a possible brain tumor. He needed an MRI fast. How long was the wait?
4 months before we could get our first MRI here in Ontario.
The McCreaths wanted to pay to get an MRI rather than wait 4 months for the government to provide one. However, Ontario Minister of Health George Smitherman is a staunch defender of a single-payer healthcare system and won't allow private payment for medical services. So in their hour of desperation, the McCreaths called private medical broker Rick Baker.
Bear in mind, if you have a suspected brain tumor, it's really important you find out if in fact you do have a brain tumor, and beyond that it's very important to find out if it's malignant or if it's benign. They were waiting 4.5 months to get this an MRI. Came to us on the 2nd of February of 06. On the 3rd of February they were down in Buffalo. They got an MRI which indeed showed that Lindsay had a brain tumor.
He had a mass in his brain that was the size of a golf ball.
He came back to Canada with his MRI in his hand, went to see his family doctor. He was given a May the 27th date to see a neurosurgeon. Now this is back on the 3rd of February.
I was angry at the waiting of 3 months.
He didn't want to wait till May the 27th, knowing he had a tumor.
So I got on the phone to Timely Medical, Mr. Rick Baker again.
Once again, we went back to Buffalo.
The surgery was scheduled for within a week's time. Our GP said go.
Lindsay McCreath got his brain surgery in the U.S. The results of the biopsy? Cancer. Luckily, a well-contained grade 2 astrocytoma tumor.
If that had been a class 4 astrocytoma tumor, he would not have made it. He would not have lasted 8 months. He would have, in all likelihood, have died. We compressed the whole process from the MRI to the consultation to the biopsy to the surgery in 4.5 weeks. Lindsay's doctor, family doctor of 35 years, Dr. McGee, estimated he might have waited as long as 8 months.
My father passed away a few months before this happened, so we happened to have the money there. But if we hadn't, I would have put a mortgage on a home to go for the surgery across the border rather than wait 6-8 months, which is ridiculous when your life is threatened. You're desperate. You don't know where to turn. You need help and you can't find it anywhere. He found help for us.
Mr. McCreath wants to get his money back. It cost him $28,000. He made an application to the government. He was turned down flat. They said, no, we can't give you your money back. You didn't ask us for permission to leave the country to have your surgery. He knew that the permission process often takes as long as getting the surgery in Canada to begin with, which has been estimated at 8 months. We're going to make an appeal and then an appeal of the appeal. We are putting the government of Ontario on notice that if they do not look favorably on Mr. McCreath's application for a repayment of his $28,000, we are going to take this as far as we have to get justice for our client, even if it means a Supreme Court lawsuit.
In 2005, physician Jacques Chauly and patient George Zeliotis challenged Quebec's ban on private health insurance. Their lawsuit went all the way to the Canadian Supreme Court, and they won. Mr. Baker's lawsuit against Ontario on behalf of the McCreaths may also fare well in the courts. Isn't it ironic that while the Canadian government's monopoly on health care is slowly crumbling in the face of widespread suffering, liberal Democrats in the U.S. are pushing to adopt a system much like the one that has failed so miserably in Canada?
Now, I understand that there is a movement afoot in the U.S. by in certain circles to try and duplicate the Canadian system in the U.S., trying to adopt a single payer system in the U.S. Then where will I send my clients? I'll have nowhere to send my clients. Your hospitals will be backed up. You people will be waiting 2 and 3 years for surgeries. I'll have nowhere to send Canadians.